there's any question, please put it in the Q&A column so that we can discuss it later after the second speaker presentation. Professor Marco Gambacciani. Pasha, could you please?
Okay.
Could you share slide, please, Pasha? Marco, I'm supposed to read your CV first. Wait.
Okay.
So, although I know that you don't really need an introduction, but they asked me to read your CV. So here it is. Professor Marco Gambacciani. He's a professor from Santa Chiara University Hospital, Department of Obstetrics and Gynecology Piero Fioretti in Pisa, Italy. And of course, he's a member of numerous national and international professional societies, and also member of the executive committee of the International Menopause Society and the European Menopause and Andropause Society. And a well-known author, of course, the author of over 190 papers published in peer-reviewed international journals. To Professor Gambacciani, the time is yours.
Okay. Do you see my slides?
Well, no, not yet.
Okay.
Yes.
Do you see it?
Yes, we can see it.
Unfortunately, I don't see mine. There is something wrong here.
No, I can see your dog.
Do you see the screen now?
Okay.
This is my first slide.
Yes.
Do you see it? Okay. Thank you very much for the invitation, first of all. And my task today is to discuss with you the clinical role of laser for the treatments in gynecology and female urology. And in the last few years, there has been a very great numbers of vaginal of energy-based devices for vaginal treatments. So from 2010, we had in 2010 we had only 2 lasers. One it was the Erbium YAG laser we are using, and 1 CO2 laser. And after 8 years, we had 6 Erbium lasers, more than 30 CO2 lasers, more than 10 other lasers, radio frequency, IFU, and so on and so forth. And this created great confusion in the field. But as Neza already told us, not all lasers are created equal. And the Erbium smooth with the Erbium laser with a smooth technology has some characteristics that make the smooth vaginal Erbium laser intrinsically safe and very effective. And Neza already said why we are having such good results in terms of genitourinary syndrome, menopause, and mainly stress urinary incontinence. And if you go to PubMed, you have a bulk of scientific evidences on vaginal treatments with vaginal Erbium laser, including the VHI, the Vaginal Health Index, the personal scores of pain, the personal score of dyspareunia or dryness, the maturation index, vaginal biopsies, different scales for female sexuality. And for stress urinary incontinence, you have a lot of evidences in terms of ICIQ, SPAT test, bladder diary, perinometry, and also urodynamic evaluation. So there are a lot of clinical evidences saying that the Erbium smooth laser, that is the only evidence-based device based on energies that is non-ablative, without any is completely operator independent, mainly after the introduction of the robot technique with the G-Runner, and with a huge database available with evidence-based scientific evidences. So when we are dealing with the vaginal Erbium laser using the Fotona patented smooth technology, we are talking about an evidence-based technology. So, I mean, there are not any other devices in the literature that has this bulk of evidence. These gynecological procedures are very easy to be performed. Why I'm saying so? Because all the procedures are validated by the company with some preset parameters inside the machine, minimizing the intra-operator and the inter-operator variations. And this is why, as Neza already showed, we were able to collect a huge database all over the world with more than 100,000 women treated with the same machine, with the same parameters. And we have these fixed procedures for VVA, for vulvovaginal atrophy, for the stress urinary incontinence, for the vaginal relaxation and prolapse. So all these techniques are reproducible and are appropriate for multicentric studies. And we'll see in my presentation some of these results. And in addition, for the future, we have to deal with the G-Runner robotic probe that is very easy to use. All the procedures are fully automated and very precise, allow us to do very uniform treatments, eliminating completely the inter-operator variations, and is even more suitable for multicentric studies. So all the procedures are preset, all the procedures are standardized, and the operator are operator independent. So, dear colleagues, we know that the genitourinary syndrome of menopause is a kind of epidemic. More than 80% of the women after the menopause, they are going to have some genital symptoms or sexual symptoms or urinary symptoms like urgency bound that are really due to the estrogen deprivation and estrogen and testosterone deprivation, and having some very important negative effect on quality of life of postmenopausal women. I'm not saying that with the Erbium laser we can abandon all the other strategies, but definitely with the use of normal vaginal lubricants and moisturizings, with a low-dose vaginal estrogen therapy, or even systemic HRT when prescribed for vasomotor symptoms, or with the use of spimefen or prasterone, the vaginal Erbium laser is a valid alternative, is a valid option to be used also in combination with other therapies. But for that, I'd like to underline that all the data that you are going to see presented in my slides are obtained just with the use of vaginal Erbium lasers. And again, as Neza said, in the last 10 years, we saw more than 80 papers published in international peer-reviewed journals. So again, the Fotona's non-ablative and smooth Erbium YAG applications are the best evidence-based supported gynecological application in the market. So these machines, they have on the back a lot of science. And in the last 6 years, we were organizing in Pisa, Florence, and Rome the Vaginal Erbium Laser Academy meeting. These meetings were held thanks to the support of Fotona, and we were discussing all our results around the world, and we were able in the last live meeting held in Florence in November 2019, a very important, was a very important meeting, and we were able to get together all the presentations and to publish on Climateric volume of January Climateric volume of 2020. And as a menopausologist, my first interest was to use the Erbium laser for the for GSM, for the genitourinary syndrome of menopause. Briefly, the RenovaLase, the Fotona standardized procedure for vaginal atrophy, is a two-step protocol. One step, full beam treatment of the vagina. Second step, patterned beam treatment of the introitus and the vestibulum. And this is possible, dear colleagues, just because the vaginal erbium laser is very gentle, and also we can adjust the fluence from the vagina to the vestibulum, and we can treat all the vestibulum that is very sensitive with a laser, just because we are not inducing any lesion. We are not microablative with the smooth technology. We just induce an increase, as Neza already said, an increase in temperature that increased the vasodilation and increase in neocollagenesis in the tissues. We usually do 3 sessions, 30-40 days apart, and we are using nowadays almost every time the glass speculum that is very gentle, more gentle than the old wire speculum, but this is very suitable also for very narrow vaginas. And in the case of severe atrophy, the vaginal glass speculum is suitable to be introduced without patient discomfort. Just a little tip, I put just one drop of water on the top of the glass speculum. Don't use too much water, because as you know, the erbium is fully absorbed by water, so we don't want to have a lot of water in vagina, but just one tip of water just on the speculum to ease the introduction of the speculum, and the patient doesn't feel anything later. So first of all, I'd like to share with you the effects on signs and symptoms. These were our first experience done under patients, and you see as the percent reduction of the visual neurologist call for dryness and dyspareunia. You see L1, laser 1, laser 2, laser 3, and the follow-up after 4 and 12 weeks. As you can see, there is a decrease of about 40-50% after the second treatment of both dryness and dyspareunia, and the effects has maintained with a reduction about 60-70% of the entity of the dryness and dyspareunia after 4 or 12 weeks. And you see, dear colleagues, the increase in the vaginal health index score. I remind you that 15 is the kind of diagnostic limit for vaginal atrophy, and all these patients, where they were showing an atrophic vagina, having a mean of 11 as a vaginal health score index, and you see an increase after the first, the second, with a stabilization over 20, that make the patients very happy around the time after 12 weeks. So, but the question was, at that time, how well results can compare with the standard treatments, and also how long the results can last. And for that, we follow up our patients for 2 years. We are talking about 200 patients treated with a vaginal erbium laser, and we compare the effects of vaginal erbium laser with a local treatment done in 50 women. And you see, the vast majority of these women were treated with vaginal estriol cream. And you see, for 3 months. And you see here, both dryness and dyspareunia, as already shown before. You see the decline in the visual analogy score for both dryness and dyspareunia in both groups, vaginal erbium laser and local treatments, mainly estriol. And you see here the decrease, but when you see in the dots the effects of laser, it is maintained at least till 12 months, 1 year after the stopping our treatment. The treatment was L1, L2, L3. We started the follow-up for 12 months, and you see that after 12 months, this point is statistically significantly different from the baseline. So it means that the effects on both dryness and dyspareunia is maintained 12 months after the end of a laser treatment. Conversely, I should say, as expected, in the women treated with the local treatments, when you stop the treatment as per protocol, after 3 months, you see that both dryness and dyspareunia, they come back. You see here in the squares, this point is statistically significant from this one. After 3 months, the symptoms are back if you stop local treatment. As in our private practice, everybody can tell, you know. And this is a major difference with the from local treatments with the erbium laser, because the effects are rapid and long-lasting, at least 1 year. And you see here in this table the effects in 200 patients. Only 2 repeated the treatment after 3 months, 20 after 6 months, but the vast majority of them, more than 110 patients, repeated the treatment after 12 or 18 months. And I should say, only 5 women were still happy after 2 years without any treatment. But the bottom line of this table is that the 84% of the women, they asked to repeat the treatment, meaning that the effects of the treatment are there, are valid and very well appreciated by the patients. And this is true also for breast cancer survivor. In normal women, we have the option of using the vaginal estrogens. At the moment, we cannot use vaginal estrogens in postmenopausal or even perimenopausal women or premenopausal women treated with aromatase inhibitors, with the GnRH analogs or different type of treatments for breast cancer. And therefore, we need a safe and effective alternatives. And the vaginal erbium laser is a very effective alternative. You see here the dryness and the dyspareunia in a very young postmenopausal women suffering from breast cancer. You see the youngest, she was 37, and the effects are there after 1, 2 treatments. You see the effects are there last 12 months after the end of the treatment. And we published this data on menopause 4 years ago. This was a very interesting paper for me, because it gave us the possibility to help these young women suffering from breast cancer. And now in my hospital, we do have an open access for breast cancer survivor with the Fotona laser for the treatment of vaginal atrophy. And this is important for sexuality, mainly in young women, because in women treated with the vaginal erbium laser, we see also in breast cancer survivors an improvement in the hypoactive sexual desire disorder in women suffering from vaginal atrophy. You see, I remind you that in the female sexual distress scale, a score more than 11 discriminates between women with the FSD and women without FSD. And you see that after the second laser treatment in women suffering from FSD after breast cancer, you see the decrease of the pathology, and the effects once again are maintained for 12 months after the last laser treatment. This is a very important issue. You should say there are only 29 patients. You're right, there is a small group, but for that we tested the effects on sexuality in 47 Italian centers thanks to the Vaginal Erbium Smooth Laser Academy, and we got together 1,200 patients collecting a lot of tests for sexuality and stress urinary incontinence. The centers are spread all over the Italy and plus Malta with the friend Mark Brinkat, that is a very famous gynecologist that is using the Erbium Smooth Laser also in Malta. And these are the results obtained in 554 women. So it's a huge database. You see here the effects on FSDS revised test in baseline conditions and after 4, 12 and 24 weeks after vaginal erbium laser treatment. You see, 6 months after the last laser treatment, the effects on sexuality is maintained. These are the result of very large, multicentric and prospective study done by the Italian Vaginal Erbium Laser Academy. The same is for the FSFI in all the domains. Also the orgasm, clearly the effects of the laser is just local, but is improving sensitivity, is improving satisfaction, is improving lubrication, and therefore improves also the orgasm domain. You see the total score 15 goes up to 27, and the effects are maintained for up to 6 months after the last laser application. And again, these data are published on the climateric volume reporting the proceedings of the Vaginal Erbium Laser Academy meeting held in Florence in the November 2019. And this is a typical email you can receive from your patients. Dear Professor, I am free of pain completely. After 2.5 years of continuous pain, it's gone. First improvement was after the first laser treatment, more improvement after the second, complete improvement after the third. I'm only using progesterone now every third night. That's usually I'm using. I don't know how to thank you. We'll stay in touch and see you sometime in February, March. Best wishes. This is something that as a physician, it very makes you happy. And we have as a physician to thank Fotona to give us this tool to improve the quality of life of our patients. And therefore, as Neza said, as Italian Menopause Society, we included the laser therapy for the treatment of vaginal atrophy in postmenopausal women, even recent of the late stage of menopause. We didn't include in the peri or premenopausal women, even if 10-20% of women are starting complaining vaginal atrophy, dryness, difficulties during the sex, during sex, even before the menopause. But we don't have evidence-based medicine data in premenopausal women, and therefore we cannot include the laser therapy in perimenopausal women. But definitely it works even in recent onset of menopause and the late stage of menopause. But what should we do also for stress urinary incontinence? For many women, in the last 10, 15 years, 20 years, been suggested to put these nets, these meshes, this stuff, saying that these are minimally invasive. But surgery that is designed to restore anatomy is not suitable for all women. And usually physicians selected surgery in patients with advanced stages of a disease. And so the vast majority of women suffering from stress urinary incontinence, they remain untreated. And they are asked to do the Kegel exercise, the pelvic floor exercise, or to use the pads. In my personal vision is that is too little for them. You know, if young women using pads, young women try to do the Kegel exercise. Nowadays, we can say that with the vaginal erbium laser, we can help. These are very pioneeristic data published by our friend Ivan Fistonich, published in 2015, reporting the effects of a vaginal erbium laser of IncontiLase on the stress urinary incontinence. As you can see, there is a decrease, important, a significant decrease in the stress urinary incontinence in these women followed after up to 6 months. So with an improvement of stress urinary incontinence. These are data obtained in 175% of the patients by Sabina Senka and Urska Ogrinic. You see here, they got 62% of the patients without any urinary leakage after 1 year from the last laser application. So you see here that the effects of laser are very important, and the effects of laser, the 77% of these patients that were dry after 1 year, if they got only stress urinary incontinence at the baseline. When they got mixed urinary incontinence, stress and urge incontinence together, you can have just 34% of the patients dry after 1 year. So these slides show us the patient selection is critical in order to predict the results that we can have in our patients. So patients with this pure stress urinary incontinence, they have the better opportunity to see an improvement, while patients with a mixed urinary incontinence or patients with just urge incontinence, we are going to see not so many successful results. So we should select patients with distress urinary incontinence. And these are our own data obtained in 114 patients suffering from stress urinary incontinence. You see here the effect, once again, L1, L2, L3, the 3 laser applications at 1 month apart, and the follow-up up to 24 months show us that the effects of lasers is there up to the 12 months. So you can counsel your patient saying that the results are meant to be there for at least 12 months. And afterwards you need to repeat the procedure. So 69% of the patients repeated the treatment after 12-24 months. Few patients are satisfied after 24 months. But dear colleagues, please take into consideration that out of 114 patients, only 9 underwent surgery. So only 8%. So we can say that we didn't perform under the more than 100 surgeries that were not justified. Just because you know, we don't say that we can replace the surgery, the minimally invasive surgery, with a laser. But it counts. What we are saying today is that before putting the patients in the operating room, just try the IncontiLase procedure in order to see if your patient can avoid the surgery. And I'm saying so also because we do have randomized clinical trials published already and produced by Professor Adolf Lukanovic, that is the director of OBGYN department in Ljubljana, showing us that in laser-treated women, in comparison to sham-treated women, we do have a significant effect on stress urinary incontinence. So the randomized clinical trial is already published, and we are waiting for the publication of the large multicentric trial that Neza were talking about. And the power of VELA was so strong, at least in Italy, showing us that in the last 24 months we were able to collect data in 62 patients, in 62 centers, sorry, in almost 1,300 patients. You see the effects on ICIQ, and the effects are there once again for 12 months, and the effects are lost after 24 months. Again, you see, we can see the effects in more than 200 patients. And the effects are present also in hysterectomized women. So with Tamer Erel, our Turkish colleague, and with the Ivan Fistonic, the Croatian colleague, we were putting together our data showing that the effects are similar in hysterectomized women and in normal postmenopausal women without hysterectomy. So we can counsel our patients even after hysterectomy, suggesting the use of a vaginal Erbium laser to improve stress urinary incontinence. And this is a very important piece of information. We do have, thanks to the fact that the Erbium laser with a smooth technology is not ablative, we can treat the urethra. And this is very important. We can treat inside the urethra with the Erbium laser, slow, low fluence, 4 pulses, and we can improve both the intrinsic sphincter deficiency patients, the type 3 stress urinary incontinence, and the patients with GSM, genital syndrome menopause, with the urinary component, meaning dysuria, stranguria, pollakiuria, even urge incontinence, with the intraurethral probe with an external diameter of just 4 millimeters, and is very easy to use and almost painless. And we are in depth of Adrian, with Adrian Gaspar that was doing very pioneeristic studies, showing us that this Erbium smooth laser is able to induce a controlled hyperthermia with a vasodilation and improve urethral trophism with an increased thickness of transitional epithelium, improvement of submucosal vascular plexus, and definitely increasing intraurethral pressure, so the sealing pressure with no damage of the tissues, no ablation, no carbolization, and therefore suitable for very safe multiple repetitions. And I do have patients, they have already had 3 different treatments after 6 to 12 months with intraurethral vaginal laser. Do you see an improvement in women that are very difficult to be treated? Women with an intrinsic sphincter deficiency, we can see an improvement in 82% of the patients after 6 months. And these patients are desperate. You know, these patients are leaking urine almost every day, all the day. and an improvement of the continence in this patient is crucial for their quality of life. And with the intraurethral device, you can say that you can help them in more than 80% of the cases. This is important also because even also women suffering from genitourinary syndrome of menopause, they have dysuria, frequency, they have urgency that can be treated with estrogens, but sometimes women cannot be treated with estrogens. And with the intraurethral Erbium laser, you see the effects just after 2 sessions. Adrian Gaspar published just 2 sessions. I usually do 3 sessions, but you see the effects of dysuria, urgency, and frequency. They are very effective action of Erbium smooth laser on the urinary symptoms of genitourinary syndrome of menopause. Dear colleagues, you are aware about the safety concern about the laser used. I should say, first of all, that this was generated but too much by a marketing pressure, by a strong marketing pressure without evidence, scientific evidences. And in fact, the FDA, the American Food and Drug Administration, sent letters to US distributors. And you can see here all these distributions, 7 letters saying that they should promote what they can promote. Without data, they can't promote anything, because they were because they saw in the States the growing number of manufacturers marketing the device for unapproved by the FDA, saying uses that they say vaginal rejuvenation, with the tissue are typically destroyed or reshaped. And I wrote an editorial with my friend Cervini, saying that the FDA's announcement was primarily a warning to laser manufacturers not to promote their devices for an unapproved gynecological procedures. And by the way, go back to the previous slide. I'd like to underline that the Fotona distribution was not there, okay? Because the Fotona policy around the world is to be very strict to the evidence-based results. And by the way, they were referring to 46 cases, very few cases, over thousands of procedures done in the US. And you see, these cases mainly were related to pain in the vagina, also because they were using the ablative procedures with the CO2s or radiofrequencies. And therefore, these invasive procedures can cause pain, burning, or scarring. But definitely, with the vaginal Erbium laser, you cannot see that. And thanks to the VELA organization, we can say the VELA final word in terms of safety. And Neza already showed you this huge global survey reported at the VELA by Zenko Visiting and published in the last procedures supplement. You see the final evaluation, as Neza show us the most reported side effect is a quoted side effect is just vaginal discharge. That is not a side effect, as Neza said. It's just a demonstration that there is an increase in vasodilation and in the vaginal increase in the vaginal functions. As you can see, the frequency of the patient's complaints is very, very low, almost nothing. Therefore, the minimally invasive thermal only, I call them the second generation after the first generation was the CO2 laser. This is a second generation non-ablative vaginal erbium laser procedure, appears to be safe with the incidence of adverse events very, very low. If vaginal discharge is an adverse event, I'm now saying that is an adverse event, it's just the effect of the laser. And in fact, the vaginal erbium laser obtained a certification in different, in the European Union, Australia, Singapore, Canada, Taiwan, and now we are facing even a new development for the superficial dyspareunia. We are going sometimes treating with the vaginal erbium laser, the vestibule and the introitus size is not enough to improve rapidly the superficial dyspareunia. And for that, we can have a new gynecological partner that is neodymium, that is allow us to have an homogeneous deepest penetration of the heat, that is safe for all skin types, for dermatological application, and I shouldn't be an issue. Any kind of dermis you have here, you can apply neodymium without any problem, and is a very high reliability, and the neodymium is an extreme versatility in pulse duration. And if you use the piano at a very low fluency, usually you use 150 and 300, we can use the so-called Gyne 4D for the treatment of superficial dyspareunia, pairing both the erbium and the neodymium all together. And now we have this clinical protocol to collect information, large databases, to provide solid evidences for the treatment of posterior commensure atrophy, but also the postpartum scars or the reliquate of chronic infection, AV and lichen sclerosus. This is a very new approach. A very new approach for the superficial dyspareunia of our patients. And to make a long story short, we are using for the Gyne 4D an all-inclusive treatment for vagina, vestibule, and vulva, pairing both erbium smooth and neodymium, and we are using Renovale smooth, fractory, piano, and fractional resurfacing for the treatment. I should say also cosmetic treatment of the vagina, but cosmesis is nothing without function, and function is nothing without cosmesis. And actually, the improvement of cosmesis, the improvement of the appearance, the improvement of the vulva is bound to increase in the functions. And in fact, we think that this photothermal treatment can give you the possibility to treat your patient with a non-invasive, comfortable and very low downtime procedures to improve all the function of the vulva and the vagina. And we are going to publish with Adrian Gaspar and Jorge Gaviria this essential for gynecological 4D in the next few months in order to put together all our work to develop around the world our new protocols. These are our first data. You see, with the Renovale definitely works on superficial dyspareunia. This point is statistically significantly different from these points, but definitely when you pair the erbium laser plus the neodymium, the effects are more rapid and long-lasting. Therefore, I think the Gyne 4D is a new non-invasive option to restore functional and aesthetics vulvovaginal condition. It remains an office walk-in, walk-out procedure with treatment that lasts 20-30 minutes, and has a very high success rate, resulting in a restored vulvar and vaginal function with very little or no downtime at all. This is a new task for the VELA family. The VELA family is the biggest gynae laser community around the world. And I hope that some of you, or a lot of you, are joining us for the development of our clinical protocols for the quality of life of health of our women. I don't know how to say, but grazie, terima kasih. Thank you very much.
Terima kasih. Marco, thank you very much. It's very interesting presentation. Both of you have excellent points to be discussed further. We have many questions already. Okay, I think, shall we move to the Q&A session? Neza and Marco, are you ready?
I'm ready.
Yes? Oh, okay, so here's the first question. Has there been any, oh wait, sorry. So this is a question from Dr. Francisco Cristianto Raharjo. So I think the bottom line is that Fotona laser is easy to use and has minimal harmful effects. Is there any side effects such as burn in vagina? I think you have mentioned that in your slides, Marco, but maybe he needs to ask further. How about the vagina prolapse? Is there any experience to use this Fotona to treat mild vagina prolapse? Marco, please.
Yeah. As I said, that all the protocols are very easy to use because all the machines they do have a fixed protocols. The parameters are already set by the producer, by Fotona, so we just press a button and that's it. So all the data I showed for the RenovaLase and IncontiLase were obtained with the Fotona preset parameters. So everybody around the world using the Fotona machine, using the Fotona parameters, and expect to get the same results. That is very important. It is important also for us as researchers also to collect data altogether and to publish the results. This is possible just because all the parameters are preset in all the machines. You can change. If you want, you can change the parameters, but in the studies we usually use the preset parameters. And I never saw a burn in vagina. I saw some scanty bleedings in very atrophic vaginas. That's it. Scanty bleedings, but no bleedings at all. I report the experience of one patient that 3 days after the vaginal application, the vaginal treatment, she called me saying that she had a vaginal burning. 3 days after. 3 days after. I don't know why she got a vaginal burning. I never saw the patient again, but this is my experience. I treated thousands of patients, and I can tell you that just one patient called me 3 days after saying that she got a burning vagina. I don't know why. Usually, if you touch the teapot, the burning cessation is immediate. You don't burn your hand 3 days after. 3 days after.
Yeah.
Okay. So I don't think that it's gonna be related to the vaginal Erbium laser treatment, but I cannot tell you anything else because I never saw the patients anymore. That's in thousands of patients that I've been treated. So and after the vaginal prolapse, yes, the vaginal prolapse, as Neza said, I don't know if Neza wanna add something, but the effects of vaginal Erbium laser is more evident on cystoceles. There is a reason why. Because if you think about the anatomy, the fascia is more represented in the anterior compart. The posterior compart has a very thin fascia. And so there is a very few collagen fibers to be stimulated. while in the anterior compartment, you can stimulate the collagen production by the vaginal erbium laser, and the effects are more evident. Definitely, our procedures, the vaginal erbium laser procedures, they cannot work on hysteroceles because the uterus prolapse, the single uterus prolapse, is due to the rupture of cardinal ligaments, and you cannot do anything with the laser. But the vast majority of patients complaining of cystoceles and some rectoceles, they can have benefits from the prolapse laser, together with the effects of urinary incontinence. I don't know if Neza want to add something on that.
Yeah, maybe Neza, you want to weigh in?
I just wanted to add first on this question of burns. This is exactly what I wanted to support Marco's claims, that if and when the burns happen, it is mostly related to user error, because users deposit maybe too much energy to one place, and if they happen, we saw the numbers in the paper, this is in 0.15% of patients.
Yeah,
they are probably related to user error, which is why we introduced this robotic probe to avoid any such let's say mishappenings that are very unpleasant for the patient. About the prolapse, I think, like I said, I'm not a medical doctor. What I know is from the papers, so which more or less support what Marco said, that we have experience with cystoceles, and that's it. There is nothing I can say.
Okay, Marco, could you please stop the screen sharing so that it's bigger?
Okay.
Yeah, sorry.
Okay.
Okay, that's great. Okay, next question. Has there been any research about the R09 handpiece that can be used for hemorrhoids?
I don't have experience on that. I leave
Neza, maybe.
Yeah, with the Erbium YAG laser, we don't have experience on hemorrhoids, because not even with the smooth modality. For this, let's say, vascular components of the hemorrhoids, the neodymium YAG is more convenient. And we have some users who are doing pioneer work with the neodymium YAG and treatment of hemorrhoids. So hopefully we will get these papers published soon. We have clinical data, but with the Erbium YAG laser and the handpiece that this R09 the doctor is asking about, we don't have.
Oh, okay. Okay, so moving on to the next question. Can we use laser in vulvodynia and or lichen sclerosis? Can we use it routinely? I think Marco has mentioned it a little bit on his slides, but yeah, of course we can discuss further.
The new Fotona machine has also some probes used with a neodymium for pain. The name of this probe is Marco, but it's not after me, okay? It's not after me. The name is Marco. And it is they can be very useful for vulvodynia. I usually treat vulvodynia with Erbium. I use Erbium with a low fluence, following the Adrian Gaspar indications. Adrian called this procedure hyperstack. I mean, a lot of stacks, very low fluence, increasing the temperature, and it works perfectly for the pain, for clitoris sensitivity, and the devascularization. definitely the work with lichen has been done. A lot of work on lichen has been done, and showing an improvement of lichen. I didn't put it this slide, I'm sorry, I just forgot about the lichen because I didn't do any formal study myself on the lichen, but the lichen has been studied, and we do have studies and data showing an improvement in lichen with the erbium, and I think that the association of with the neodymium is of help for all kind of vulva indications, because the neodymium has is a very important role for the dermis, and therefore I think that the association of the erbium and the neodymium is going to give us a very important result in the near future, both for vulvodynia and for the effects on lichen.
How many treatments is it?
All the treatments, all the data that you saw on both stress urinary incontinence and on vaginal atrophy were 3 treatments 1 month apart. In the clinical practice, sometimes I do 1, sometimes I do 5, depends on the patients. But usually are 3, usually are 3 treatments. Sometimes for prolapse or for lichen, you need more treatments in order to improve the clinical conditions. But for the vaginal atrophy or for incontinence, usually with 3 treatments 1 month apart, you got the results you want to have.
And then once a year for maintenance, is it?
And for maintenance, yes, once a year. Sometimes 2 treatments are enough to. I say to the patients usually, you come back when you feel the need to another treatment. It usually is something between 6 and 18 months.
I see. Neza, please.
Can I add just something about the vulvodynia and lichen, about this routine use? We have many different approaches in Fotona that we are testing about the lichen sclerosis and also vulvodynia, like Marco said, with combination of erbium YAG and neodymium YAG. And we have many studies done. So we are at the moment not sure, because there are still many studies ongoing, which of these protocols, which of these approaches is the best, which is why at the moment we cannot say try this one or try this one. We have shown with each modality it works, but combination probably works the best. But before we say that, before we claim this, we want to be sure, we want to have evidence for this. So, and also vulvodynia, there is an ongoing trial in Vienna, in Austria, that they are doing this sham controlled trial to see if there is clinical improvement, or this clinically meaningful improvement for the patients.
Again, evidence-based, yeah. So you need more to state something, you need more evidence to it. Yeah, I agree.
Or to choose
about, yes, indeed. How about adding some medication or regimen? Is it needed before and after the laser treatment? Maybe like combining it with a topical hormone such as estradiol or estriol. Will it actually improve the end result? Please, Marco.
Definitely it improves. Sometimes what I'm doing is to induce an improvement with the laser, and afterwards to go with the local treatments. Also because in Italy, the local treatments are reimbursed by the National Health Service, so are for free for the patients, while laser are not reimbursed. unless you are not in Pisa. And we do have in Pisa just for breast cancer survivors. So, the laser as a problem, as a very big problem. This is costly. For the vast majority of patients, it's very expensive. So maybe sometimes in the private practice, in my settings, I do one, I do two, and I start giving the hormones or hyaluronic acid preparations. But with the laser, you definitely improve just one or two applications. You do improve the vagina situation right away, and you maintain the effects with the hormones or with hyaluronic acid. And this is very effective, and the colleagues is right. The association, the combination therapy is very effective, and the laser can give you the opportunity to counsel your patient to use vaginal creams, gels, suppositories, not all the nights, but just twice a week. It is very annoying for the women to use vaginal treatment every night. And there are data showing that all over the world, not only in Italy, but all over the world, women stop the treatment, local treatment, just because they are annoyed of local treatments.
Yes.
With the laser, you can improve vaginal condition right away, and you start with your vaginal suppository, either hyaluronic acid, estrogens, progesterone, or whatever, every other night, twice a week, let's say. And this is very convenient. They save some money, and the effects are there and long lasting. And sometimes they repeat one laser every year. I have the Fotona laser since 2013 now. So I have patients. They come to see me every year, and some patients that they perform the laser treatment for 5 years in a row, and they just do one or two treatments, and they are performing the local treatments or systemic treatments with estrogens, and they are just happy to improve with the laser the vaginal condition. The effects, as I show you, can last for at least 12 months. So one or two repetitions after 12 months is more than enough. And the patients are happy about that. Also, they save money.
Oh, that's nice. Neza, do you agree?
Yeah, but again, these are clinical experience from a practical point of view, which is I sorry cannot comment.
Okay. I'd like to comment on again on lichen. There is not a lichen lace released by Fotona. That's important. And as independent investigator, I should say that I'm very happy to collaborate with Fotona, because Fotona has this policy. As Neza said, since there are different clinical experience, they are not sure which one is the better, and therefore the signature Fotona, they didn't put the signature Fotona under any one of them, because they are not sure which one is the better. And this is very important, and you must be confident. I'm not saying so because I am here in a webinar with Fotona, but I always say so. They never recommend something that is not evidence-based, and this is a great. It's great for the physicians. Okay, it's great.
It is. It is. Yes, it is great. So ideally, how long is the shortest and the longest to repeat the laser treatment to still having good results? Marco.
I usually counsel my patient to come to see me for the laser after 20-40 days, I'm sorry. 20-40 days, just because this is the collagen effects of laser, mainly on working on urinary incontinence. You have the shrinkage of the collagen fibers right away, and afterwards you have the starts the new collagenesis that lasts at least 3-4 weeks, and therefore
Yes.
it doesn't make any sense to induce a new collagen shrinkage maybe after 10 days or 15 days. So you want to wait at least 3-4 weeks, and no more than 40 days, usually, because otherwise you lose the possibility to have the add-on effect of repeated laser exposition. And these are you can counsel your patient to see you every 20-40 days, okay, mainly for collagen remodeling. For the vasodilation, maybe you wanna in very severe situation, using the hyperstack. Again, is a clinical experience, is no Fotona recommended. Sometimes I ask the patients to come after 15 days. I do the hyperstack again in order to improve the vaginal and vulvar condition with both the erbium and neodymium. But this is a clinical experience. There are no formal data to counsel our colleagues to do the same. It's just a chat between colleagues. Okay.
Yes, yes. Neza, please.
Also, one comment about the number of sessions that you do one after another and then wait for a longer period. We have experienced that doing more than 5 in a row will not have any larger clinical relevance. So if your patient, because you will probably have a patient who will not benefit from laser treatment. So if your patient doesn't benefit after 5 treatments, then probably this patient should be counseled to do another treatment. So up to 5 in a row, and then repeated top-up treatment after a year and a half, or even 2 years.
I think you refer mainly to the stress urinary incontinence, to the IncontiLase.
Yeah, and prolapse.
And prolapse lace, yeah. So it's the collagen effect of the thermal treatment of collagen. But for the atrophy, for the vasodilation, the more you do, maybe is better in terms of mainly with the new hyperstack ideated by the Adrian, with the very low fluence in improving the vasodilation. This is very important, you know. Now again, at the moment there are no formal data, so we cannot counsel our patients to do what we are doing at the moment.
Yes, noted. So I think this question goes back to the first question. Is it possible for side effects of bleeding occur after 1 day of the therapy?
Yeah, sometimes you have scanty bleeding from the vaginal wall. If the vaginal walls are very, very atrophic, you induce the thermal treatment, and mainly due to the effects of the speculum, that they can induce some bleeding, but as very, very scanty. They don't need sanitary protection. They don't need any kind of treatment. They resolve in a few hours after the beginning of bleeding. You know, they are probably spottings.
What about it didn't happen right away? It happened 1 day after. Is it possible?
Oh, you know, if the bleeding is in the upper part of the vagina, the patient can see the bleeding after hours or after the day after, just because the bleeding is so scanty that before coming out it takes hours. You know, this depends how huge is the bleeding. Is like after the menstruation, sometimes the patients are bleeding spottings for 2 or 3 days, very dark bleeding,
Right.
Sometimes this is just the remaining of bleeding or menstrual bleeding in the vagina that starts to be lost even after the endometrial bleeding is stopped. You know, endometrial bleeding is stopped.
Yeah.
The blood is going in the vagina and it start to be lost from the vagina maybe for a couple of days afterwards. It depends on the amount of bleeding. Since after the renovase speculum introduction, you can have a very scanty bleeding. You will see your patients. Your patients can see the bleeding even the day after, but usually is brown and
Yeah.
it's very few, very few.
Yes, yes. Neza, does Fotona require or recommend a pap smear or a gynecology checkup before doing any vaginal laser?
Yes, this is actually in all our applications manual. We have some that patients who have had a normal pap smear test in the past, let's say 2 years, because you have probably depends from country to country, but you have this screening every 3 years. So we have guidelines, recommendations for patients who do not have normal pap smear test to not to receive the laser treatment, because otherwise, afterwards, we don't know how to resolve the issue. Because if you have how to say, when we do not target, where this laser treatment does not target the cervix. So we cannot imagine how would the laser treatment influence the pap smear. But still, nevertheless, if there was an abnormality in the smear, if you're not familiar with the technology, you could get scared or stuff like that. And also the active herpes infection is also, of course, the contraindication for laser therapy.
And yes, if may I add something.
Marco, do you want to weigh in?
Yeah, may I add something? Because as Neza said, that with the vaginal erbium laser, we don't treat the cervix. Because if you see the probe that we insert in the vagina is the 360 degrees treatment of the full beam and of the vagina, but not on the top. And therefore you don't treat the vagina, the cervix, I'm sorry, the cervix. And this is a problem, for example, after hysterectomy, because you cannot treat the vaginal vault with the R11. With the R11, you don't treat the vaginal vault after hysterectomy. And for that, you need to use a freehand treatment. But again, this is a clinical experience. There is not any formal study done by Fotona. But again, as Neza said, with a vaginal erbium laser treatment with the probe R11 probe, you do not treat the cervix, so you cannot induce any positive or negative effect whatsoever. But again, I endorse what the Fotona says: a pap smear and the regular oncology screenings must be advised to our patients.
Yes, thank you. I think it has been an interesting discussion. And as all things, it must come to an end. So shall we wrap up? I think it's already minutes after 9. We already passed the time. Thank you again to Professor Gambacciani and also Neza Koron and all the participants. Good evening, and I give back to Fasha. Thank you.
Okay. Thank you, Dr. Alfa. Thank you very much to Dr. Marco and also to Neza. Thank you very much for both of your wonderful presentation and answering all the questions from our participants. Please excuse me, I would like to give little bit information for our participants. Please don't leave yet. Oke, untuk para peserta, ada yang ingin saya sampaikan. Terima kasih untuk para peserta yang masih bersama kami sampai sekarang. Oke, ini adalah hal yang ingin saya sampaikan. Seperti yang bisa dilihat, semoga bisa dilihat di layar, TimeWalker IntimaLaser launch. Jadi kami memberikan beberapa syarat dan ketentuan apabila para dokter dan peserta tertarik dengan mesin laser kami. Seperti yang bisa dilihat, info yang pertama yaitu harga laser kami yaitu 1,3 M. Lalu apabila dokter membeli mesin laser kami, dokter akan mendapatkan free handpiece intraurethral seperti yang tadi sudah dijelaskan oleh para speaker kami. Ini ada gambarnya. Lalu juga bisa cicilan 1 tahun dengan bunga 0%. Lalu cicilan bisa menggunakan leasing, MNC, dan OREX, syarat dan ketentuan berlaku. Dan apabila ada hal-hal yang masih ingin ditanyakan dan masih ingin dibahas tentang mesin laser kami ataupun ingin tertarik untuk minat demo di klinik atau rumah sakit dokter, bisa langsung menghubungi tim marketing Fotona Indonesia seperti yang ada sudah tertera di layar dokter. Masing-masing nomornya ada Yunia, Putri, Fatra, Fasya, dan Cindy, bisa dihubungi masing-masing nomornya seperti itu. Oke. Okay, once again, thank you very much for all of the speaker. Thank you for Dr. Alfa. Terima kasih dokter sudah menjadi moderator kami lagi, and also thank you to Neza and Prof Gambacciani. Oke, untuk para peserta saya akan memberikan link untuk mengisi evaluation formnya sebentar lagi ya. Oke. Okay, so thank you so much, and stay safe and stay healthy, everyone. Thank you for the wonderful night. Is it okay if we take pictures first? Okay, just smile to your laptop camera.
Sure.
Okay, 1, 2, 3. Thank you so much. Bye-bye. I will Thank you, Neza. Thank you, Prof Gambacciani. Thank you, Dr. Alfa.
Thank you for inviting me. Thank you very much. Bye-bye.
Thank you very much. Bye-bye.
Bye.